Hello friends, good afternoon. We have to discuss about fibroid today. So what do you have to say? Where are you being from? You have to sit down and watch. Fibroid has dealt with us so much. It has dealt with so many women. It has caused so many issues. It has denied women from having their children. It has denied families of being happy the way they are supposed to. It has caused so much bleeding in women's life. It has caused so much anemic state. So now we have to treat it. We have to understand what it's all about. We have to clear whatever novice state that it has granted us at any particular time. Some questions that we have to ask that we are confused about, where sometimes people have asked several questions. Where is this thing coming from? This and that. So now you have to sit down and watch. We're not going to take your time. You have to understand what fibroid is and causes, things that has already enriched it, or things that have triggered that growth, or certain things that we need to do in order to limit the growth of fibroid. Okay, here we go. So what is fibroid? You have to understand fibroid already is a benign tumor that grow in uterus, and they need a supply of certain nutrients and hormones to grow and sustain themselves. Okay, so let's go ahead. Now, when you've understood that it has association with some hormones and some nutrients, in order for you to keep growing and causing those problems it has been causing, so you have to keep your ears so open, concentrate so much, avoid distractions, and understand, so that you can help your neighbors, you can help yourself, you can help your younger ones or your elder ones, you can help your stepmothers and your mothers, whomever it is that is having this challenge. So sit down and watch. So coming to things that has actually associated itself to this fibroid. One is estrogen, secondly is progesterone, third is insulin, another one is glycogen and oxidative stress. So we have to treat it one after the other. So when you talk about estrogen are fibroid dependent, meaning that they need estrogen to grow. Estrogen is one of the hormones that help women. It's amongst women and reproductive hormones. Estrogen is there. Estrogen stimulates the growth of fibroid cell so well, so richly. Okay, that is why you find out that when women start entering menopause, or when you see that when the menopause already a woman has entered menopause, you see estrogen dropping so well. Okay, we'll go ahead with progesterone. Why estrogen promotes the growth of fibroid? Progesterone helps to sustain that growth, that tumor that has already been there. In other way, you're taking certain drugs, or some people are telling you have to avoid this, have to avoid that, and then you're still seeing the progesterone being sustained. You're still seeing it not moving. Go to ultrasound, the same size it has been giving you, it has maintained. Know it well that your progesterone also sustains the growth. Another one is insulin. Insulin resistance again is another cause of fibroid growth. Insulin resistance and high insulin level can contribute to the growth of fibroid. Open your ears and understand that. We have treated something about insulin and its resistance. Okay, now it's glycogen. So you have to take care of your intake of sugar. Be careful what you take in. Be careful what you take in. Okay, so glycogen. Fibroid needs glycogen, a complex carbohydrate, to grow and sustain themselves. So you have to reduce your intake of glucose, glycogen, carbohydrate meals. Oxidative stress again is another thing that affects women and causes fibroid growth. Fibroid thrives in an environment of oxidative stress that has resulted by radiation, your alcohol intake, and the rest of which occurs when there is imbalance between the radicals and oxidative stress, oxidants in the body. Okay, so we have to also treat some dietary factors that may have fed the fibroid. Some of those dietary supplements or the dietary factors that has equally held in, like high sugar food. Consuming high sugar food always has also contributed to the issue of the fibroid, the growth of fibroid. The questions you've been asking. You know, here in Africa, we like taking carbohydrates. You take your swallows in the morning, you take in the afternoon, you take in the night. Be careful, because the insulin resistance and high insulin level, which we always encounter at every given time, encourages the growth of fibroid. So you have to manage your intake, your carbohydrate intake, to make sure that you limit the growth or the chances of having fibroid in your system. Again, your dairy product. Some research suggests that dairy products, particularly those high in estrogen, may contribute so high in sustaining fibroid. Another one is red meat. Any red meat of all kinds. So people will ask you, is cow meat among the red meat and the rest of it? It contains red. It's a red meat. It's not white meat like that of chicken and turkey. Okay, so red meat contributes so much because it's consuming it in a large quantity, contributes in a processed meat that you've taken, and also will increase your risk of developing fibroid. Another one is food high in advanced glycation. So now that glycation N, which we call H, Okay, so foods high in advanced glycations and product, it is age, is so much contributing to the growth of fibroid. What are those food we're talking about? Those food that has been overcooked, those red meat that has already been overcooked, develop what we call edge products such as cherry meat, may promote oxidative stress and fibroid growth. I will explain oxidative stress later, possibly in the next topic. So while we are taking care of dietary charges alone, we may not eliminate fibroids completely. A healthy food rich in fruit, vegetables and grains and lean proteins may help reduce their growth and eliminate symptoms. Basically here, what is the challenge of fibroid is those pain, those bleeding that comes forth. When you're having those issues, I will advise you go for your surgery. Remove it. Remove it. It gives you the chances of having your children the amount you wish for yourself. If you have fibroid and it's so much, when people are telling you can do this, you can do that, yes, there are certain dietary supplements, dietary foods, the fruits you can be taking that will increase your enzymes, but at the same time, once it has come to the level of affecting your chances of taking it, please, I will advise you go and remove it. Once you remove it, see yourself, you take it and the bleeding stop, and any mistakes you find yourself all the time stops, and the mental stress that you go through all the time stops. Your stability comes at work, your productivity comes at work. So my advice here is we should make sure we avoid taking estrogen rich food, avoid taking more of progesterone rich food when you're having fibroid, possibly because of the financial factors. You have to avoid insulin resistant cases. You have to avoid the intake of sugar, the processed meat, the overcooked meat and the rest of it. Please, as we are addressing this issue, we are talking to yourself. Help yourself and make sure that you don't have fibroid in the future, and those who have it already should avoid carbohydrate rich food. Help yourself in taking more of fruit and make sure that your blood is always intact. There are some people that can actually take in even at the point that they have fibroid, and at the point you conceive, you take your 9 months term, and after you're in your term, the CS is what you're going to use in bringing out your baby, and in so doing you rejoice, everybody rejoices, and your second issue, you don't have any issues again, you still give birth normal. Thank you as we practice this.